Be in the know with unlimited access to IBJ and Inside Indiana Business. Our in-depth coverage of all things business means you'll always be completely in the know. Subscribe for just $1 a week. Get started now at ibj.com/trial offer.
Maddox was diagnosed with autism at a fairly young age, and he has epilepsy, and he has apraxia. He most likely will never speak. I think as a parent, we all have those moments that you sit in a car and you cry.
It's very heavy. It's changed the whole trajectory of our lives. Within the first 2 weeks at Damar, I realized this was a good fit. I felt like I could take a deep breath and exhale for the first time in pretty much his whole life. I felt like he was safe.
Damar was a crucial part in building a foundation for him to learn. That's unmeasurable.
A first-hand testament from the parents of Maddox on the impact of Damar Services and the support and hope the organization gives to families like theirs across Indiana. Damar President and CEO Jim Dalton on the nonprofit's mission, the fascinating backstory on how AI is impacting what they do and what's next on this edition of the Business and Beyond podcast presented by PNC. And I'm pleased to be joined on the podcast this week by Jim Dalton. Jim is the president and CEO at Damar here in Indianapolis. And Jim, great to see you. Thanks for joining me on the podcast.
It's an honor to be here. Thanks for having me.
Absolutely. A little bit about Damar. You know, when people hear, I think, developmental or intellectual disabilities, maybe they don't understand the full range of the needs that are involved, the services, the things that Damar provides. Give us a thumbnail description of Damar.
I will certainly try. Thumbnail's hard for an organization that does so many things, but I will try. Damar is a large, not-for-profit, for lack of a better word, social service agency that focuses on developmental needs of children and adults facing lots of challenges related to developmental disabilities, intellectual disabilities, and autism. So we provide an array of services across a full lifespan of services, everything from early intervention and early evaluation for children that are toddlers, evaluations for autism, all the way up through the geriatric population. And we do that in so many different ways. We do things like very acute hospital programs to community programs to school programs and therapy programs, ABA clinics. We do that at about $140 million of annual revenue, and we do it with about 1,400 employees. And today at Damar, we're serving about 1,800. Well, we're serving exactly 1,833 people. I get that update every day.
Yeah, wow. That's substantial. And you've been around for a long time, I think 50 plus years. So Damar really is an important and big part of the community.
Yes, we have, and we've been growing, and we've become a more significant part of the community as we've faced a lot of these challenges that the folks that we're so committed to serving face every day.
As you look at when you talk about the needs, developmental, intellectual disabilities, how serious are some of these individuals and families, the issues they're dealing with?
Gary, it's overwhelming at times for what we see with the families. Damar, obviously we serve a continuum of care. So we do see some folks that have lower needs, but our specialty is really with severe needs. So we see families that are dealing with behavior and developmental issues that they just never expected at all. Of course, they never expected their child to be diagnosed with autism. And then with the diagnosis of autism and never anticipated the difficulties that their child would have with language, with communication, with behavioral, sometimes with significant aggression. So a lot of these families across the lifespan, early on, families are like, do I have the right diagnosis? Am I doing the right thing for my child? Am I doing the right thing? All the way up to where we see adult parents or older parents with adult children and what's going to happen to their children or adult children who need care after they die. So there's so many developmental issues that go across, but very, very serious things and great challenges for families that are dealing with these issues.
And I know I've heard some people describe it as in some ways, in some instances, Damar is kind of the last chance for some of these families.
Yeah, a lot of what Damar, our approach to issues is always say yes first. So many times we are faced with some of the state's most disabled children, most devastating circumstances. And what we've committed to do, Damar, is first saying, yes, we will help. Now, how we figure out how to help sometimes varies and what we're able to do varies. But yeah, we are committed to some of the most severe cases and situations that families are facing. And some of the children that we help that are in these dire straits, they're not even connected with families where the state may be their guardian. So yeah, just some really heart-wrenching situations that Damar finds itself in to help. And we're honored and privileged to do that.
Yeah. What are Jim, some of the misconceptions, maybe the biggest misconceptions you think people may have about people with developmental disabilities?
Yeah, I think that a lot of times what we see that people see is it's kind of the forgotten citizen, children and adults with developmental disabilities and autism, even ones that may not be able to speak. They also have dreams and aspirations. The important things that are important in our life, inclusion, activity, feeling valued, being expected places. They have those same values and those same desires. They can't always express it, but they have, expectations for relationships, and they want to be loved and they want to show love, do it in very different ways. And sometimes they're not able to do that very well, but they are important parts of our community, and they can do basic jobs and work. Some of them can do great things. Sometimes that are kind of on the higher end of the spectrum, they can graduate high school. We've even had some clients at Damar that have participated in college, things that we never thought that they could do before. So many times the clients that we're honored and privileged to serve there, they're underestimated and kind of overlooked. And what we try to do is have a campaign that gives them the respect and dignity that they deserve.
Damar's been around for a long time. You've been in this business, this industry for a long time. How is autism diagnosis, the landscape, how has it changed? And how has that affected maybe the way you deliver services?
Yeah, it's changed a lot. When I came to Damar, I'm on my 25th year at Damar, serving at Damar. When I came to Damar back in the early 2000s, the prevalence of diagnosis of autism was about in one in every about 200 to 210 children. Today, that number is about 1 in 36 children. And if you're a boy, it's about 1 in 28. So that has changed a lot. Now, there's a couple reasons for that. And my thoughts and opinions on that are one, of course, I think everybody accepts that we're better at diagnosing it. In the past, we may have seen kids that had difficulties related to autism, but we would call that ADHD, or we would even call that schizophrenia or some other kind of disorder that was more common. But we become very good at understanding the full continuum of autism and the spectrum that it is. So we're better at diagnosing it. I also believe that in the overall development of the human race, we are in a period of time where the identification of autism and the prevalence of autism actually is peaking in the human civilization. And so I think that we're seeing that we're at a peak. And I personally think we're at the peak, and then in a few years, we will see that gradually decline. But right now, I think it's a human phenomena, and we are also better at diagnosing it. I wish that with the etiology of autism, and I wish we had a cure, but we do not. But what we do have now is great treatment and great supports that we haven't had before. So we're happy about that.
How about the importance of dealing with the family? They've got a child with autism, with services that you're providing. How does the family factor into the services that you provide, and how important is that family piece?
Very important. It's one of the most important things when we talk about positive outcomes. Family engagement, family participation is one of the highest predictors or protective factors when it comes to children that have autism and that have very significant needs. So at Damar, many times the needs are so significant that parents are having difficulty in their own homes. And imagine this, having to hand your child over to an organization, to people that you really don't even know that well, but you have no other choice. And for to trust us to develop a treatment plan. But we know that when families are engaged and they get the right education and they have the right motivations and actually have the skills, that prognosis becomes quite good. And so we know the earlier we can intervene, the more families are involved and engaged, the better the outcomes are for these children.
There's the human element. There's also the policy, the economic realities that you face on a daily basis. Jim, as you look at policy changes around ABA therapy, autism services, changes here in Indiana, what is changing? Give us a kind of your take on that, and how is that affecting your business? Because you are a nonprofit, but let's face it, nonprofits are businesses too in a big way. How is that affecting Damar?
They are. And of course, this is one of the biggest challenges that we are facing. I was honored to be appointed to Governor Braun's ABA task force, where we were looking especially at the Medicaid spend for ABA therapy and how it's significantly increased over the last several years. During that time, this great group of people, we were working to figure out how could we still give quality services in ABA clinics, but also handle the Medicaid spend that was really becoming overwhelming. So with that, we made some recommendations to the governor around stabilizing rates and having some caps on lifetime services and other nuanced things that we would do that would help that. But in the meantime, you may have heard in the news, I'm sure that you have, that there was some abuse in the system that started long ago. In 2019, when we first were beginning to bill for ABA services, there wasn't really a code for it. Medicaid, along with many providers, we had to develop a code and what this would be. So Medicaid, like they do with a lot of new services, said, hey, why don't you guys provide your service? Let us know what your rates are, and then we will together develop these codes and understand this more. That began, and it began in a great way under the Holcomb administration. And then COVID hit, and there were a lot of absences. There was some different oversight from the Medicaid office, and we had some bad actors in the ABA, mostly for-profit organizations. Not all of them. Some of the for-profit organizations are fantastic providers, and I support them 100%. But we did have some bad actors that were increasing their rates to significant levels and really abusing the system. And I think that's what the uproar has been significantly lately. And we've been super disappointed. And now I'll give you an example. Damar provides an hour of ABA service. We bill Medicaid about $76 for that, and they will pay us for that. Other organizations that were abusing the system for that same hour were charging $800 and $900 for that same service, because there was a loophole in Medicaid that allowed them to do that. And but I think the Braun administration has come in. The FSSA secretary has taken a very hard look at this. And so it's been some tough meetings we've been in, but there's some hammers dropping and the ABA industry is changing. So it's been a real challenge. So economically, we're faced with some new realities, and places like Damar, we're trying to look at new ways that we deliver the service, how we can combine our schools with ABA services to make sure that we can have robust services and also be able to afford to provide it.
How is that? Because we hear it every day, the fraud stories that you mentioned around the country. How does that spillover affect Damar and organizations like yours? It's got to have, unfortunately, some collateral damage, if you will.
It is. The thoughts of fraud, sometimes that's kind of collectively put out that ABA clinics are full of fraud. And that is absolutely not true at all. So many great providers out there that are providing the service, but it has had an impact. Families are more skeptical. They can be more resistant to care. The folks that pay us now, they're not as trustworthy, and I guess nor should they be. And so a lot of these bad actors have equated to a lot more cost for places like Damar, because we have to manage more audits, and we have to, make sure that our financial audits we're ready for that. That takes more personnel, more cost, and we really want to spend the money down at the client level. So it's some trust that needs to be recovered. We have families that we know that probably need services that maybe are hesitant to have those now. So it's really affected us. And I'm hoping there's a smooth road to recovery. I hope with a partnership with the state that it will be. But some of our families are really in positions they'd never been in before, both the ones that we're serving now and the ones that we'll serve in the future.
Yeah. Talk about new ways of doing business. Certainly, artificial intelligence, all industries, whether it's for profit, nonprofit, no matter the industry, is impacted by artificial intelligence, using it in different ways. Is AI something that you're exploring in terms of using it to improve client care or the services you provide?
Yeah, I'm glad. You asked. I think that we have become certainly interested in AI. Our board years ago, we learned about machine learning and how could we treat kids better and take some advantage of some of the technology that was coming out. We couldn't really figure out a way to do that because you can't really replace human treatment, human interactions for
Right.
children with
Right.
autism and things. You really can't. But luckily, Damar came up with an idea that is the first ever thought of the idea, the first that'll ever be done. We actually have submitted a patent to Washington, D.C., and we've had some firms that we're working with. And I'll try to explain what we're doing. It's a
Yeah.
little complicated, but Damar has about 700 employees that we call direct care employees. And those are the employees that work directly with our folks individually, hand over hand, day by day. And this level of employee is one of Damar's greatest assets, but it's also one of Damar's greatest liabilities and places like us. So think about this. When I talk about this, people don't know the industry of Damar very well, like residential treatment settings, but they do know things like nursing homes. And one of the greatest concerns that people have with having their parents, their elderly parents, placed in nursing homes is lack of appropriate care. And what we've seen across the country, especially since COVID, but even before that, is a phenomena that we never seen before. It is employees, again, some of them wonderful people, but some that seem to not have the same motivation as they did in the past, and some that have their own challenges in their lives. So Damar has developed a component of AI that we're using AI to develop and promote the best working situation that we can have. And that is to use behavioral principles with our employees and the way that we pay them. So what we've done is we've developed an initiative called the REAL Initiative. REAL stands for responsive, engaged, active, and loving. And we use video and audio in our treatment units, outside, in our vehicles. And when our employees, our very important employees, are engaged in those behaviors that we have operationally defined, we actually pay them more dynamically for that hour. If they're not exhibiting those behaviors, their payment goes down to the baseline. And we do those sampling in kind of a interval schedule. So that a variable interval schedule. So it takes human reinforcement in a way that we've never used before in employment, and also the reinforcement of being paid. And so we pay them more dynamically for that. And so far in our pilots of this and at our organization, we've seen tremendous changes. We've had a significant reduction in incident reports. We've had a significant increase in staff satisfaction and staff retention. We're beginning to talk about this product that Damar has developed and that is patent. And we already have many customers in the state of Indiana waiting for us to roll this out. And so we are super, super excited. I personally believe in my lifetime of being a child psychologist, this will be the most important contribution that I've ever made to the mental health, the intensive mental health industries. We could not be more excited about it.
That's fascinating, and it's something that you've patented, and it's a Damar product.
Yeah. Imagine this coming into work and your body is scanned and machine learning learns you, and it learns everything about your physical appearance, who you are, the shape of your head. It learns you across the way. And then as you engage in those behaviors that we train them and tell them exactly the behaviors, that dynamically feeds right into our payroll system and increases their hourly rate. It has been a remarkable kind of experience that we've had, and we are so proud. We also think that it will ultimately be a great revenue producer for Damar, kind of a non-related business revenue that we will have. We're not for profit, but that would go into another category for us. But we expect it to be implemented. It's kind of an irresistible invitation when you talk about what's the biggest challenges you have. CEOs around care industries are always saying, it's our employees. That's the most. And we've solved that problem. And we just can't wait to roll it out. By the end of this year, it will be in other facilities. We have a pilot of other facilities, about 6 other facilities. And we think in 2027, we'll begin to roll that out to the nation.
Wow. Well, workforce obviously is such a huge issue for all businesses, for all industries, not only here in Indiana, but around the country. The behavioral health industry, I'm sure, is especially challenging to get the workers you need in there. How do you describe the challenge you face workforce wise, and maybe how this new initiative, this new patented technology might help that?
Yeah. So, of course, workforce stability, workforce quality, and workforce quantity has been a real challenge for organizations like Damar. Again, Damar has 1,400 employment positions. And in the past, we've often gone with 110 of those not filled. And so when that happens, of course, people have to work more, they're more stressed and those kind of things. So what we found is the implementation of our new initiative. We've had much less turnover, much less staff satisfaction, more kind of engagement and training for the reinforcement that we're providing. So we are super engaged with that. Now, at the other side of our spectrum, physicians, mental health licensed therapists, ABA, doctors that we need. There's a shortage there too. And not only is there a shortage, but when I'd say 10 years ago, if we were going to hire a mental health therapist, a licensed mental health therapist, Damar may pay them about $46,000, $48,000 a year. Now, someone fresh out of school that has a license, mental health license, we're paying near almost $80,000 a year. So it is a big increase, a great opportunity for them, but challenges for places like Damar that need quality people, but also kind of run on a very tight budget. So lots of challenges there. We do think the AI initiative is going to make a tremendous change. It already has at Damar, and we expect it to help all care industries, including medical care industries as well.
Much more ahead with Jim Dalton, the president and CEO at Damar here in Indianapolis. Talk a little bit about Jim's background and what's next at Damar. That's when the Business and Beyond podcast returns. Stay with us.
As a bank, PNC prides itself on being boring. But the truth is they couldn't be more excited to serve the dynamic Indianapolis community. For nearly 160 years, they've quietly toiled away to deliver brilliant results for their equally brilliant clients. They have dedicated PNC teams throughout the local area all ready to do the boring work to help you unlock your own brilliance. PNC Bank, brilliantly boring since 1865. PNC Bank, National Association member FDIC.
We build Indiana. The Laborers International Union of North America builds and maintains roads, bridges, and other essential infrastructure that make us the crossroads of America. So thanks to LIUNA members' work, Hoosiers have a better quality of life, like access to utilities, easier routes to jobs, schools, or medical care, and deliveries keep moving. We build Indiana for good jobs and stronger communities. The Laborers International Union of North America. We are LIUNA.
And welcome back to the Business and Beyond podcast presented by PNC. My guest this week is Jim Dalton. Jim is the longtime president and CEO at Damar. And Jim, we were talking about some fascinating technology before the break and things going on, the ever-changing world of your industry. It's changed a lot over your time. And I think you mentioned you've been at Damar for about 25 years.
Yes, I'm on my 25th year of service.
Yeah. You're a licensed child psychologist leading Damar. What originally drew you into working in that space, working with children with challenges? What kind of got you interested in it?
Well, I set out to be my parents, and I set out to be a pastor of a church. I was raised in the Church of God out of Anderson, Indiana, and my family was very much into that. My father was what I would call an evangelist, my uncle evangelist, my grandfather an evangelist, and so that was what my parents thought was great for me. So they sent me to Anderson University to become a preacher, and during that time, which was great at Anderson, I thought that I was receiving the calling, as they call it, but ultimately didn't feel like I felt the full calling to lead my own church. So I was kind of caught in a dilemma there. What do I do? Have a lot of dissonance. So I knew that it was important for me to serve. I knew I wanted to serve, and I knew I had the calling to serve in some way. And I'd always been interested in pediatrics and health of children and the well-being of children, and had that in my own family. So I began then to kind of say, well, what could I do to help? And that's when I started into psychology. Didn't at that point learn quickly that being a psychologist took a lot of training and a lot of years and a lot of money and a lot of commitment to be a child psychologist, but got through that. And then I've been really lucky in my life. I've had some of the most wonderful experiences professionally that one could ever imagine. In my life, I don't know of any employment position that I've had, which have not been very many as a professional psychologist, that have not just been the most wonderful experiences of my life. Being at Damar for the last 25 years has certainly made me a better father, a better husband. It's made me a better person. And I get so many personal benefits just of being able to serve others, especially those that are having these challenges related to developmental. I work with some of the greatest, smartest people you'll ever meet. So it's been wonderful for me, and I've been really lucky.
Everybody, all professionals from time to time struggle with that motivation piece. Sounds to me like you're in a business that you value as something that the work motivates you. Extremely challenging, but at the end of the day, it's rewarding as well. Is that accurate?
I can't wait to get to work every day. I just can't wait. And the I think I've also been gifted a little bit with being an energetic, positive person. I'm lucky that way. And so one of the things that I think is so important when you're serving others is to be great role models and to have always serve them with dignity and respect and be the great social models. So at Damar, we strive to do that. And it's kind of an accountability, high energy, super commitment, great customer service. We're far from perfect. I'm certainly far from perfect. But those things and the way that you influence other people, that's one of our big values at Damar. And I've been lucky to be able to lead that drive here.
Jim, as you look going forward, what's next at Damar? You've got a lot on your plate, and we mentioned that AI technology that is fascinating to me, and I know we'll want to do something on the show on it, I'm sure, at some point going forward. But as you look at next steps and kind of your vision for what you see the next big things at Damar, what are those things?
Yeah, we still have long waiting lists here at Damar. Our private schools, our public schools, all of our treatment programs, our ABA clinics, all have long waiting lists. And that's what's really driven our expansion. You're probably aware that not only do we have a large central campus here in Indianapolis, and many outpatient clinics, but we also acquired a property up in East Chicago that's fully operational as a campus. And then recently, about a year ago, we acquired a large property, about a 90-acre property in Richmond. And that Richmond campus is just now taking off. So we have a lot to do around focusing some of our expansion. Another thing that you'll see Damar do is we're going to be expanding our public school options across the state. That'll be a major thing that we do. We want to make sure that we're providing ABA the way that needs to be provided. So we're going to slow down a little bit with that and really focus on quality outcomes. We are waiting for the time that Damar is at a place where we can go, you know what? We've served what we are serving the people we need to serve in Indiana. Let's look outside our borders. We're not there yet. I believe we'll be looking at another strategic plan development starting this fall. I believe we're still probably going to stay in Indiana because of the significant waiting list that we have. But our partnerships with the state and with our payers, and certainly with the people that support Damar, have just been wonderful. Damar's future is super bright, and I look forward to being a part of that, at least for a few more years.
Good. Well, Jim Dalton, it's been a real treat to catch up with you and really fascinating to hear everything going on at Damar. The impact you're making can't be overstated, and it's been that way for a number of years. And I know with your growth plans, it's going to expand around the state and perhaps beyond. So thank you for the time, and I look forward to seeing you soon.
Thank you. I appreciate the opportunity. Talk
All
to you
right.
soon.
Jim Dalton, the president and CEO at Damar. And thank you for joining us on this episode of the Business and Beyond podcast. We're presented each and every week by PNC. We are a weekly conversation with achievers in business, sports, entertainment, and beyond. And you can download all of our episodes and get Indiana business news 24/7. All you have to do is go to InsideIndianaBusiness.com. I'm Gary Dick. Thanks for joining us. We'll see you next time.
Hi, I'm Dave Neff, host of Talent Scout. On this show, we shine a light on Indiana's next generation of leaders who are making a difference in business, community, and civic life. These are real conversations about purpose, mentorship, and building a future that matters. Join me as we invest in leadership that lasts. Subscribe now on your favorite podcast app or listen at ibjpodcasts.com.
Thanks for listening to this IBJ Media podcast. You're probably going to remember this ad. Do you know why? Podcast advertising works. 85% of listeners recalled hearing an ad during a podcast, and 70% of podcast listeners have acted after hearing an ad. So whether you're looking to be heard across the entire IBJ Media Podcast Network, sponsor one of our shows, or just start with a 30-second ad, IBJ Media can help. Contact advertise at ibj.com to learn more.